about the cost of your pregnancy, of the follow-up of your pregnancy. So when you go see a doctor, every appointment, you should think about paying between $50 to $300 every time you see the doctor. The cost is different from a family doctor to a gynecologist, which is a specialist, and you only need to see a gynecologist if you have a high-risk pregnancy. So if you're waiting for twins, or you have high blood pressure or diabetes, so otherwise you can go see a family doctor. In your follow-up with the doctor, you're gonna have to do blood tests and other kind of exam. You can go do those exams in a clinic, in a CLSC, even in an hospital, and you're gonna pay between $450 to $600. Then there's the Écographie. Normally an echo in Quebec for the pregnancy, we ask the woman to do an Écographie at the second trimester, which is between 20 to 22 weeks. In this echo, you're going to see the baby, you're going to see the brain and the heartbeat and everything, so we can see if the baby's doing well. But you need to know that it's not an obligation to do an echo, so it's your decision. Lots of parents are really waiting for this time because you're going to see if it's a boy or a girl, and then you can see if your baby's doing fine. But it's not an obligation, and lots of pregnancy can go really well, and you can have your baby even if you don't pass any echo. You're gonna have to pay between $150 to $200 for the echo. Normally you don't need to take any other echo, but it's possible that your doctor asks you to do another one earlier or after 22 weeks. It depends on the doctor, and you can ask your professional why he's asking you to do another echo. Think about if you need to do the echo around 32-34 weeks, which is the third trimester, it's going to be a bit more expensive. So it's important to call the clinics, radiologist clinic, to make sure of the price before you go. And you're going to need to have a prescription from your doctor to do the echo. There's no need to do an echo every time you see the doctor, so if he's asking you for one every time he sees you, ask him why he's doing that, and because you're gonna have to pay every time. Also, you're gonna have to pay for the doctor, for the test, and for the echo, and think about the price to open your file in a clinic. So if you go one time in a clinic, you're gonna pay around $50 to $75 to open your file. So this is supposed to be only one time, the first time you go to that clinic. But if you change clinic every time, you're gonna have to pay every time. Now let's talk about the midwife. It's a specialist that works in a birthing center. And the birthing center is attached to an hospital. So you're gonna have to pay a deposit for the hospital. Normally, if the delivery is doing fine, you won't have to go to the hospital, but you still need to pay the deposit, just in case. So you're gonna have to pay from $10,000 to $17,000 for the hospital. And then you have to pay for the midwife. So the midwife, the follow-up with the midwife is all the pregnancy follow-up, the delivery, and then the follow-up up to 6 weeks after the delivery for you and the baby. This is from between $3,500 to $3,700. So if the pregnancy is doing fine and the delivery is doing fine, you might have to pay only this fee. If you do the delivery at the birthing center. Otherwise, you might have to pay for the hospital as well. You need to know that those fees don't include all the exam, the blood test that you need to do, and the echo that you need to do during the pregnancy. Now let's talk about the price for the delivery. So first, you need to know that every woman has the right to go in any hospital in Quebec to deliver. because delivery, it's an emergency, so you can choose your hospital even if you don't have any money, you don't have any medical coverage, it doesn't matter, you can go to the hospital to deliver. If you call the hospital before you deliver, you're going to talk to the person at the admission or at the accountants, and they're going to ask you to pay a deposit. This deposit could be between $10,000 to $15,000 to $17,000. So it means that you need to pay, that's what they're going to ask you, to pay all this money before you go to the hospital, and some might tell you that you won't be able to deliver if you don't give that kind of money. Some hospitals might offer you a package deal, so you need to ask the person what is included in the deposit or in the package deal. Depends from one hospital to the other, so it's your responsibility to ask your question before you go to the hospital. But again, you don't need to pay if you don't have that money. You don't need to pay before you go deliver. If you don't have the money, you can go and deliver in an hospital. Let's talk about the fees for the hospitalization. So when you go and deliver in an hospital, the fees are from midnight to midnight. So if you go in the hospital at 8 at night, or at 10 at night, you're still gonna pay 24 hours till midnight, and then you're gonna pay another 24 hours from midnight to midnight. Those fees include the room, the services for the nurses, and all the medical services that you're gonna receive while you deliver. Those fees cover for the woman, the pregnant woman, and the baby if the baby is not covered. To know if your baby is covered or not, you can watch the video that we made on the RAMQ coverage for babies. Now, you're gonna have to pay for the doctor as well, because the doctor is an autonomous worker, so he's asking to be paid by the government. So you can try to negotiate the price with your doctor that's gonna do the delivery, but it's possible that he doesn't want to do it. Some doctors in some hospital already have a price, they all charge the same, and some just ask what they want. So you're gonna have to ask your doctor the price that he's charging to help you deliver. You have to know that it's possible the doctor that did the follow-up of your pregnancy won't be the one that do the deliver. So even if you talked about price with your family doctor before, if it's not the same doctor, you might have to negotiate again. And you need to know as well that you have to negotiate before the deliver, because after the deliver, it's too late. Let's talk about the anesthesiologist. Is the person a specialist that's going to help you to ease the pain while you deliver? So here in Quebec, you can get an injection, which is named an epidural. The epidural is a medication that the anesthesiologist can give you in the base of your spine. This medication won't make you sleep, it's just gonna ease the pain while you deliver. The epidural is not considered as an emergency, so you decide if you want it or not. In case of a C-section, there won't be any question, the epidural is gonna be given to you anyway. So the anesthesiologist is a specialist, a doctor specialist, so you can try to negotiate again the price with the doctor, but it's possible that he refuses. Think about paying between $200 and $1,200. The price between one hospital to the other hospital could be really different. All the hospitals in Quebec that offer the deliver, because it's not all the hospitals that do it, but all the ones that do it are really good. So you don't need to go in the more expensive one. Normally when they're more expensive, it's just because they're more specialized. So if your pregnancy is going fine and you're not waiting for twins and your health is good, you can go in the cheaper hospital. Otherwise, you might be transferred anyway to an expensive hospital where you're going to receive special care.